to get a little bit of connection of who you are, your history, the work that you're doing in homeopathy, the work that you've been doing in India.
Okay. I finished 4 years of studying homeopathy, full-time course, and I did 6 years of medical doctor, and I did my MD with specialty in oncology. And then just last year, I did my PhD in oncology. And since last 36 years, I'm integrating homeopathy in the modern medicine. So I'm attached to many hospitals in and around Bombay, and I run a department of homeopathy. And now since last about 7 to 8 years, I have also started a department of integrated cancer department in modern medicine. So this is the kind of work I do. And I had a huge experience in treating critically emergency, very severe pathological cases, handling them in intensive care unit with homeopathy. So this is my specialty. I'm adding all my clinical information of modern medicine into the synthesis repertoire. So most of this information related to advanced pathology in a rubric form are all my addition. Plus I have studied Jungian psychology. So a lot of psychological rubrics, and I integrate Jungian philosophy in case taking Jungian philosophy in understanding materia medica. So that's my another specialty. So this is what I am.
So your work is really groundbreaking in a lot of ways. And I would like to first touch the point on oncology. What is it that first got you interested in pursuing a career in oncology?
In fact, I never wanted to become a doctor to begin with. It all was an accident. I was always fascinated to become an engine driver in railways. You know, I wanted to drive an engine, and I was about to take an admission in an engineering line. But because some of my very close friends went to the medical line, so I said, then I'll be left all alone if I study engineering. So I
No
just followed
kidding. Wow.
I just follow the trend, you know, something like that.
Yeah, well, thank
And
goodness you did.
and then yeah, and then once you enter the medical school, then you don't feel like coming out because then you are with your friends, you know.
Right.
So it was a fun, you know. And after that, I got married. I had 2 daughters, and then after my birth of my second daughter, there was a seat available in the city of Jaipur, not in Bombay, to do this MD course uh, with oncology. And so I appeared for the entrance examination and I got selected. And I spent 3.5 years in Jaipur and did my study. At that time, the field of oncology had very little reference to homeopathy. And so maybe that was the big challenge for me to identify whether homeopathy can really work in cancer patients. Let's put it that way. So I had just work of Grimmer and Lippi on my table, more of Grimmer's work and little bit of Burnett's work, you know, but very scattered information. And I wanted to apply them clinically and find out its efficacy. So that's why I used to do it in a very small way, in personal way, I would rather say. But then when I joined, yeah, please
An
tell me.
impersonal way, you say.
Yeah,
Yeah.
personal way in this means my private patients. But then when I joined the PhD course, it was a big, big challenge because for years I was denied to do PhD using homeopathic medicine.
Ah.
Because you know the allopathic lobby is extremely strong, and then medico-legal problems. And it was a tough, tough, tough thing, and I had to fight it out. They didn't recognize me. They didn't recognize homeopathy. They wanted proofs and studies as a background information. And then there were no studies available in the research department or no studies available anywhere in the world related to cancer. So they said, okay, what we can do is we give you 20 patients. We observe you for 3 months. You work on our protocols, scientific international protocols, and if you don't achieve something in that protocol, you are out. So that's how I accepted to work with homeopathy and protocols, because modern medicine does not accept that patient feels better. If you say like that, modern medicine will say, okay, give me at least 3 protocols which you have used as a criteria to say that patient is better. And so that's how the scientificity came. And then gradually every alternate year, I started presenting my paper in World Congress on Cancer.
Wow.
And there also, there was a lot of opposition in the to begin with. But later on, I presented about 3 papers in a span of about 6 years regarding homeopathy and cancer. But my main focus in all these 3 papers was the pain management, how to manage the cancer pain, because I am not right now taking too many things on my head. Because if I can convince my seniors, if I can convince my hospital people that homeopathy really helps cancer patient as far as pain is concerned, then I think so they will give me more and more support. So next year there is a 4th World Congress in Boston where I'll be coming, and at that time maybe I'll meet you also personally.
Would be
And
wonderful.
yeah, and so that's I'm just working very hard for that paper so that it gets selected, because selection is also a tough job. They issue about 7,000 papers from all over the world, and they only select 130 papers.
Wow.
So I have to really work very hard for that paper to get it selected. So in this department of homeopathy that I run in hospital, we do very, very scientific work as far as cancer is concerned, and not just simply taking a case, giving a remedy. Patient says, I'm feeling much better, looking at the report. No, that's not the one which we do. We do a very detailed scientific study, because that helps us to as a case module for the future research in world congresses. So I'm working purely from that angle. But in my own private practice, of course, I treat lots of terminally ill cancer patients. I treat lot of them.
Mm-hmm.
So
So
about
tell me,
60% practice is my cancer patient as per today.
60%.
Yes, because the rest I work in hospital. So I treat very advanced cases like pneumonia and severe infections, kidney failures, cardiomyopathies. So for me to treat cough and cold and skin allergy is not very big.
Yeah.
But
Wow.
for in my earlier years, I did a lot of pediatrics. So that's why I wrote many books on pediatrics. I wrote books on lack remedies. So that was one phase where I was with Jungian psychology, pediatrics, fairy tales, and all those things. But after doing my PhD, my whole practice has changed topsy-turvy. And now I am only looking most of the time oncology cases.
Mhm. Now, what percentage of your oncology patients are using conventional care as well as
Almost, almost all, almost
almost all?
all. To begin with, when I joined the hospital, I was only allowed to see a person who is A, terminally ill, B, he should be on minimum 60 grams of morphine sulfate. Now, 60 grams of morphine sulfate is a very big dose, because then nobody is going to give me a cakewalk in such a hospital. You follow? Nobody believes in homeopathy. Nobody has faith in homeopathy. So only those cases where nothing much can be, offered,
Right.
such cases are given to me. So still in hospital, I am not allowed to treat anybody individually with homeopathy. But if the patient refuses that, look, I don't want radiation, I don't want chemotherapy, and he signs the paper, then of course I can treat them with homeopathy. But in my private practice, I would say 5% to 10% of patients are there with me who have never taken anything in their therapy, and they are purely on homeopathy, but the percentage is very small.
Wow.
Yeah, only 5 to 10%.
So tell us about when you were first starting in the hospital, when you were able to use homeopathy and they were giving you like the patients that they were expecting no outcome with anyway.
Yes.
What was your experience like with those patients using homeopathy, and how did that lead to, the
Yes.
hospital continuing to allow you to use homeopathy?
So my whole practice was trial and error to begin with, because I had no books on my table, as I said, no repertory on my table which gives you experiences like that. So it was purely using an allopathic information, you follow,
Hmm.
into homeopathy. So let's give a very simple example. So let's say somebody is having a pain and it's a spasmodic pain, let's say. Now we all know that atropine is used for in allopathy for spasmodic pain. So what I did was, we have a belladonna, correct, which has atropine inside.
Yes.
So I started experimenting in various potencies of belladonna. And after maybe 30, 40 cases, I found out that belladonna 3C acts the best in
Three.
cancer patients. 3,
3C.
3C.
Okay.
So now I use a lot of belladonna 3C whenever I see spasmodic pain. The best part is that all these terminally ill cancer patients who are on morphine sulfate basically will not give you modalities, basically will not give you concomitants, basically will not give you peculiar cure rare symptoms as Hahnemann states in Organon. It's a different practice totally. You have to change the whole Organon and sit in front of the patient. If you are expecting a very, very classical approach in front of a terminally ill cancer patient, maybe you'll have a lot of disappointments, which I had it. Because the patient is so drowsy, he's hardly able to talk about himself. Forget the pain. Sometimes you ask his age and he will think for 2 minutes how old he is. Now,
Wow.
with such a patient, if you are going to ask him his characteristic modality and dreams and cravings and desires, because cancer patients don't have an appetite to begin with, what desire and aversion they are going to have.
Yeah.
If yeah. So it's a very different practice. It's a very different case taking approach. So what we do is basically trial and error, because if you're going to ask them, a cancer patient terminally ill with pain, what makes your pain worse? And he will say, when the action of morphine is over, my pain comes. What gives you relief? If I take morphine, I feel better.
Right.
Now this is the answer you will get.
Right.
So you have to innovate some new things, which I am doing it every day in my practice, and I'm trying to find out what kind of remedy really helps cancer patients. So most of them is a palliation, 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 palliation. And once we palliate the pain, then we palliate something else till a stage comes when he is able to give me some proper classical homeopathic information. Once I get that, then it is a very easy for me to select a constitutional homeopathic remedy and then take the case further. This is what I do.
That's phenomenal. And in that work, when you're working with people, how long on average does it take you to get from the palliative work that you do with homeopathy to finally being able to do some more of that
Okay.
constitutional work?
So most of them die during that process because
Oh,
I start only very late. You know that.
right.
It's my problem. So most of them die and they don't reach to that stage. But in hospital practice, maybe 20 to 25% people reach to that stage. But in my private practice, I don't see such terminally ill patients. I
Okay.
see them in a much, much better condition.
Yes.
And that is why I would say 70% in my private practice come to that stage where I can give a constitutional treatment.
Amazing. And are there any cases from your private practice or from terminally ill patients at the hospital that really stand out to you as like, wow, that was an
Okay.
incredible case and homeopathy just blew my mind?
So let me give you one example. So about 17 years back, I had a man who had undergone 3 surgeries of cancer of the tongue. So he had a first surgery when he was diagnosed with cancer of the tongue, then it recurred after 1 year, then it recurred after third year. And then when it recurred on the fourth year, he was tired because all his neck was totally dissected. The cheek was removed, the jawbone was removed. It is what is known as commandos surgery, where we do dissection of the muscles of the neck and we do dissection of the lymph nodes in the neck. And it was such an ugly face that he comes with a recurrence of cancer. And he did not want now to do anything to do with radiation. Of course, radiation will not help him, or chemotherapy. Again, this will not help him. The doctor said you should go for fourth surgery. He comes to me. In the beginning, I treat him locally for his cancer and then constitutionally with carcinosin. 17 years follow-up is there and there is no recurrence of his tongue cancer.
Wow.
So I have some long-term cancer patients also who have survived, but the percentage is very, very low. So not to rave about that I can cure cancer. So today if patient comes to me, I honestly say that I have no skills so much to cure your cancer, but I will try to give you some relief or I will do palliation. So I don't speak more about my skill because I'm still developing or sharpening my skill. Let's say that honestly.
That's amazing. And how humbling for us to hear that. Because how long have you been in practice? You've now been in practice for...
So this is my 38 years. I finished
Wow.
37 years with integrating homeopathy with modern medicine.
And to hear that you, after 38 years, are still sharpening your skills, it allows us to feel, you know, us young docs and young practitioners, a whole new sense of, you know, we have lifetime work ahead of us.
Absolutely, because see what happens is that simply speaking has no meaning. Huh? You have to show results and we are tackling human lives. Huh?
Mm-hmm.
So you have to be very, very careful of what you say and what you write. My PhD thesis, I am converting this in a book form, which is right now going to be published by BGen Publishers. In that, I have given some cases. In that, I have given some new therapeutics which I have developed of cancer remedies.
Amazing.
Yeah.
So even right now, as we're chatting, it's 7:30 in the morning your time, and you clearly are a highly motivated, highly passionate person. And what is the thing that drives you?
The thing that drives me is the challenge. Because see, right now in next 10 minutes, I leave for hospital. I have my outpatient department. And
Wow.
every day it is a challenge. What kind of case will come to me? And how am I going to solve this with homeopathy? So, and every day I get requests from intensive care unit. This person is dying. That person is dying. Can you come and save? Can homeopathy help in heart failure? Can homeopathy help in brain embolism? So all these things comes to my mind, and then there are no therapeutics in front of me. So what I have to do is I have to do trial, error, research, use something new. If I get result, I write it down in my diary and then use that information for the next person. Just 5 minutes back, I got a call from Toronto, Canada, where
Mm-hmm.
one homeopathic doctor is crying and she's telling me that my grandchild is suffering from Henoch-Schönlein purpura, a very
Mm-hmm.
rare disease in pediatric age group. And the doctors wants to give some strong medicine for that. And I want homeopathy. So I said, okay, let's send me some important symptoms, send me some photograph, this, that. And then I just gave the child sickle core. So I work round the clock. I come to my clinic at 5 o'clock in the morning.
Oh my gosh.
Yeah, I come because I have to work round the clock because I receive queries from all over the world to help people with advanced pathology. And if it works, then I feel so happy. And that's my motivation.
Wow. And what
Yeah.
advice would you give young practitioners, young homeopaths, as they're starting their careers and
What
stumbling
I
into
would
practice?
I would say is that first we should have a very sound knowledge of basic homeopathy. Many homeopaths miss that information. I know in America there is no proper training for homeopathy because you have weekend courses or monthly courses, no proper schools. So I can understand the plight of a homeopathic student in United States. But in India, we have got a full-time course for homeopathy. But unfortunately, most of the homeopath, even after doing 4 years of course, are extremely unskillful. And that really pinches me because they have not studied their organon, they have not studied Hahnemann. Half of them run for new methods, half of them went for shortcuts, half of them wants to do pathological prescribing or specific, half of them want to do combination medicine. The road of selecting one remedy for the patient is really difficult, but it is very challenging. And once you get the result, I think so you don't want to give it up. So this is what I would say.
And to go back to those basics, really feel
Yes.
solid in the organon, really feel solid in.
So, yes. So in most of my seminars that I teach worldwide, people ask me, what new, what new, what new? And I said, first, learn old things from me.
Yeah.
Before you do research, do search.
Yes.
Search is more important before you begin research.
Yeah.
And so I never teach anything which is modern, anything which is shortcut. I say, no, you have to first be a donkey, then you become an elephant.
Well, I think that's such a part of human nature, right? Is we're craving the new thing, the different thing, the whatever thing. And when it comes to health, when it comes to healing, when it comes to homeopathy is, the foundation, starting with those roots, the
Yeah,
simplicity of that work.
yeah, yeah.
Yeah. So tell us about you've got a bunch. You're an amazing author. You have so many prolific. You have so many books available, and got some phenomenal books in Radar Opus itself. And would you share with us, just newly available in Radar Opus is Lax in Homeopathy? Would you tell us about your book and the
Okay,
information in there and how it can add value to our practices?
so that was a phase in my life where I used to teach a lot in Holland. I had given multiple seminars in Holland thanks to our distributor of Radar, Mr. Rene Otter. He organized chain of my seminars.
Yeah,
And
remedies.
then uh, whatever my seminar notes were there, he helped me to gather all my notes and put it in a form of a book. Uh, when I started teaching lac remedies were not very popular in homeopathy. Let's put it that way, excepting lac caninum. And then when I studied Jungian psychology, when I studied the psychology of a child, psychology of a pregnant mother, the emotions of pregnant mother entering the fetus, I found out that it has lot of things to do with lac remedies. So lac humanum, lac maternum, lac leoninum, lac falinum. And so I started analyzing the emotions state of all this remedy and compare with the patient who is sitting in front of me. I had one very bad case of biliary atresia, childhood malformation of the biliary system. And the child went for Kasai procedure. It is known as Kasai procedure, where they repair the biliary tree. But then the child is highly prone to cirrhosis of liver in future, and by the time they reach about 14 years 13 years, they develop liver failure and they die unless you go for a liver transplant. Now in India, liver transplant is costly, people don't have much money. So one such child came to me at the age of about 3 or 4 years. Do you follow?
Mm-hmm.
And then I started treating the child, understanding the state of mind of the mother.
Hmm.
And I found out this was a lac leoninum case. I gave lac leoninum to the child. Today the child is 18 years old without hepatic failure.
Wow.
Yeah. So I have recorded the whole videos and I have recorded the follow-ups and all those things. So lac remedies are extremely useful if you apply it correctly. And I have given some themes, some understanding, not of all the lac remedies. I don't have experience of all the new milks, but whatever little bit information I had learned, I have put it into the book. It is in German about third edition, and in English there is a second edition running. But now I don't think so. I'll write a new edition because it's all over. Now I'm in a different phase of my life, treating cancer patients. So I would rather write more on cancer remedies.
Hmm. And you mentioned that there was a phase, because you also have the book, The Clinical Observations of Children,
Ah, good.
and yeah, your pediatric practice and
Yeah, yeah. So what happened was that I don't like people who cut paste and may write a book, because such kind of materia medica is available a lot by dozens in India. People just do cut paste, copy from 5 authors and then put it into the practice. So this is what I don't like. So what I did was I never wrote a book on materia medica. Why? Because materia medica should be one which you have experience in your practice, which you have clinically verified in your practice, but there are 5,000 remedies. How can I have experience of so many remedies?
right.
And so what I thought was that 10 cases treated with one remedy where the pathology has been reversed, that is the materia medica of the patient, because 10 such good cured cases. But then 10 cured cases of calendula, I have to wait for 10, 15 years. Calendula case does not come every day in my practice. And so when I finished my 30 years of practice, I was able to collect only 61 remedies out of 5,000.
Wow.
And I wrote it in the form of a book in pediatrics, that who can be the father of a chamomilla, what can be the mother of chamomilla, what can be the cradle symptoms of chamomilla, what can be the pre-nursery symptoms of calendula, and all those, stages of a child.
So the clinical observations
Yeah.
of children's remedies is based on 30 years of your practice,
Yes.
your clinical. Wow.
Yes. Yes.
Wow.
Just what I saw. What was the auscultatory finding? What was the finding on examining the posterior wall of the pharynx? What does the nose look like? All those minute details. And
So
then different.
important. Oh my gosh,
Yeah.
that's so amazing.
Yeah, but this is my work. Then nobody can say, oh, this is from Kent and this is from Hahnemann. You follow?
Right.
Because when you write your book, it should be your work.
Right, right. And these are things that you are collaborating with Frederick on and including in synthesis as you.
Yes,
Oh,
yes.
good, good, good.
And now the second edition of, or the third edition of pediatric book, I don't count the editions, but it is coming out next month, where I have added 6 more remedies after 7 years.
Woo!
6 remedies in 7 years. I don't like to share something which I am not very sure about.
Yeah. Well,
Hmm?
yeah, that's amazing, and we appreciate that.
Okay.
Yeah, and I know you have to run
Yeah,
to the hospital.
I
I
need to run.
cannot thank you enough for taking the time. I know how busy you are, and sharing your history and your path, and for all the work that you do for homeopathy. It is amazing. Do not lose the juice in the battery, because we need you out there doing the work that you're
Of
doing.
course, of course. Okay. See
So
you, my friend.
thank you, Dr.
Bye-bye.
Master.
Bye-bye. See you.
Bye bye.